Hello, everyone. Welcome to Psychology and Spirituality, a Bridge to Better Life discussion. During our weekly episodes, we explore the intersection of spirituality and psychology, and as a result, we are able to capture timeless wisdom contained in both fields. I am so happy and quite honored to be here with Dr. Sonia Doi. And we're going, Sonia, I'm proposing that we explore ideas of wholeness within, right? And what I mean by that, Sonia, is that during our next minutes together, we perhaps can explore the actually subtle or even invisible to some threads between mind, body, spirit, and we can even say the idea of destiny, that the long journey of our spirit. Sonia, how you doing?
Hi, Marcia. I'm doing well, and I'm very happy to participate in this discussion. Hello, everyone. It's an honor. It's um, such a wonderful opportunity that Marcia is giving me to participate in the discussions of spirituality in psychology.
Very good. So I'm proposing, Sonia, that we dive into this rich, in my opinion, quite transformative perspective brought to us by spiritist psychology through the teachings of Joanna de Ângelis. Shall we?
Sure.
Yeah.
And there's so much to learn through all the teachings that Joanna brings to us through the psychography of Divaldo Franco.
Yes, yes. So Divaldo Pereira Franco collaborated, as we know, with Joanna de Ângelis to bring a quite prolific number of
Mhm.
works, right? And doing our podcast, we dive into some of the thoughts from her, but also from many other teachings in psychology, in the medical field, in spiritism. And I just wanted to maybe we can start, Sonia, because we often, this is all of us, right? We often think of health as merely the absence of disease, of illness. But if true health is a state of equilibrium, right? That harmony that we talk about, internal harmony that we talk about, that should reflect our journey as spirits across lifetimes. I wonder if we could talk a little bit about how illnesses might actually be a kind of message to our souls. And again, what I mean by that is that the signs of imbalance may actually be opportunities, right, for growing, for healing. What are your thoughts? Can you go over any of your thoughts from your perspective, Sonia?
Sure, you're so right, Marcia. Health is not just the merely absence of disease, and that was established by the World Health Organization in 1946, long time ago. That health it encompasses a complete a state of complete emotional, mental, physical, and social well-being. And to that effect, that's basically how Joanna defines
Mhm,
integral health in the book Em Busca da Verdade, Seeking the Truth. Uh,
mhm,
uh, More recently, a lot of studies have incorporated spiritual well-being to all those other factors. So there are many factors that contribute to this state of health and otherwise to the appearance of a illness, I would say.
yes, yeah.
So there are many points where we can work as we understand all these factors that impact on our health. There are many options, opportunities, as you said, that
Mhm,
we can improve, we can act
mhm,
actively to improve our own health, to improve our own way of living and achieving what we call integral health.
Oh, that's beautiful. And we all look for that. I think that if you were, and I don't have the statistics in front of me, but if you were to perhaps dive into how many of us are seeking self-help and looking for different perspectives, not just the physical health. But I wonder if you have any additional um, ideas or statistics that can highlight us this lack of health, if you will, or how to contribute health in a world that is so fraught with trauma, with diseases, with epidemics, not just a COVID-19 epidemic, for example, but the so-called the epidemic of anxiety, etc., etc. Do you have anything that you could perhaps illustrate us, Sonia?
Yeah, there are many publications, many studies,
Mm-hmm.
scientific studies that have been published. And I would like to stress something that was brought by Joanna in the book that
Mm-hmm.
I just mentioned, and in which she emphasizes that moral behavior
Mm,
is one of the major facts that impact on health.
yeah.
And she says that this even influences the genetic inheritance. And this sounds a little bit counterintuitive.
Yeah, I'm almost cookie. What?
What? Because we know that moral flaws, bad habits impact on our health. If we have excesses of all kinds,
Yeah,
eating too much, drinking, any other excesses, vices that like pride, envy, greed,
yeah,
anger, all
yeah,
that causes stress,
yeah. And I, if I
emotions.
may interrupt you, just to add something that has made quite a impactful effect on me when reading Joanna de Ângelis, some other books. But she stresses, and this is nothing new to everyone, but culturally speaking, right? We are you are in Brazil, I'm in the U.S. Western society. We are largely driven by a very individualistic type of culture that it matches quite well a capitalist, consumerist society and enhanced by technology, right? Enhanced by the fact that for most of us, utter poverty is no longer what we experience. So we have access to money, access to, and actually incentivized to purchase things, and that feeds that immediate need for immediate gratification, right? I don't feel so good. Oh, let's just go online and shop something that will be here in 2 hours. It's becoming like that. So we mask our needs with a context that really allows that masking through immediate gratification. And at the same time, Sonia, it moves away from the need for silence, if you will, for reflection, for looking at what is behind my lack of comfort or my distress or my illness or lack of well-being. Right. So she
That
does that, but then you have this whole other aspect of uh, so many different publications on the topic, right?
that's right. If we dive into all the causes of diseases,
Hmm.
not just the biological causes, but social,
Hmm.
cultural. And all these studies show that, for example, there are culturally, um, there are differences between populations that are more that have more risk of developing some diseases, they are more vulnerable.
Mm.
The same thing, people who are in a higher social level may get, like you said, trapped into trying to balance their emotional distress into excesses of buying things, of drinking, of
Mhm.
several other ways to try to balance that emotional distress.
Mhm.
So it's all like interconnected.
Mhm.
The moral behaviors, the cultural differences, the uh, socioeconomic situations, these are
Mhm.
all kind of interrelated. They play a role balancing each other sometimes.
It's truly a
And
web, right? If you
it's
think
a
about it, where one movement in any direction impacts the rest of the web, if you will.
exactly, it's a network. There, all these factors are not isolated. So it's not just the social, socioeconomic
Mhm.
uh, condition that makes a person or a group of people more vulnerable to diseases, but it's all a context of all
Mhm.
these factors that impact on each other. And at the end, they impact on mental health,
Yeah.
which actually sometimes is expressed in physical disease. So it's very complex. There is a
Yeah.
study that was done. You see how all this is of interest to several researchers. There's a study that was done by a group. It's an initiative of
Mhm.
Veteran Affairs
Mhm.
to look into how we can improve the health of not only veterans but in population in general. They published a study in 2022 that was titled Prospective Associations Between Strengths of
Mhm.
Moral Character and Health.
Mhm.
And the results of that study suggested that persons who live life according to high moral standards have
Mhm.
substantially lower frequency of depression. And they also showed an association between moral character and mental and physical health.
Mhm.
So, this is to call the attention of public health in general
Yeah.
and healthcare providers to look into that aspect because that see impact on both depression is something that's quite prevalent these days.
Yes.
So there's so many ways that we can change, and we're talking here about psychology of Joanna de Ângelis, who you know basically leads us into improve our moral standards.
Yeah.
So I think that's quite impressive that we see researchers looking into that too. There are
Yeah.
not there are not many studies, but there are very interesting studies.
Yeah, and it's interesting because when we think about, of course, the study is zooming in into the veterans in the U.S., right? And veterans, if we were to think of what is the problem behind the problem, we see that especially those that return from combat or even long deployments away from their family, etc., physically and mentally they experience PTSD, right? They experience depression, anxiety. They also experience pain, fatigue, autoimmune issues, isolation, difficulty in reintegrating society. And I'm thinking, Sonia, this is not particular of that subgroup of people. Most of us, and I'm talking about 8 billion of us here on Earth today, we are uh, perhaps not suffering post-traumatic disorder, right? But we are going through, as you mentioned, depression, anxiety, fatigued all the time, pain in muscular pain, all sorts of pains, but also autoimmune diseases. So, from that perspective, we are in this together, and just to counter to that, I'm talking about traditional, right? Not traditional, say Eastern or Chinese medicine, but Western medicine and traditional systems of care. We often, all of us, including, we do that, including to our family members, we often focus heavily on medication or systems management, right? Symptom management. I'm sorry, symptom management. So we do this, or I have a headache, let's kill the headache or the symptom in this case. But I'm not looking, is there, I don't know, an underlying emotional wound that is being expressed or somatized by that headache? Or is there something in my I would say family system, right? Is there any um, imbalance in how we're managing just the living day to day with my family? What is on an individual aspect? What are the deep spiritual, I could say longing, right? I long for healing, but I also long for purpose. And of course, I always, whenever I think about purpose, I immediately think about Viktor Frankl, but that's for another conversation. But I just wanted to know, maybe if you could perhaps bring some aspect that specifically you referenced the book, it's not translated to English, so the English title could be something in search of truth, right? Which is in itself a great title. But how would some of the topics that she brings in the book brings an additional perspective that would add a comfort or even a broader perspective on this topic?
Let me start by going back in one of the things that you just
Mhm.
said. Traditional healthcare,
Yeah,
traditional,
yeah,
not all of them, looks into treating the physical body,
yeah,
nothing else. But recently, there's even, I think in the United States, we have a great
mhm,
service at the George Washington Institute of Spirituality and Health, led by Dr. Christina Bohowski, that is teaching physicians to treat their patients from a much deeper aspect, looking into spirituality as the source of emotions, of physical diseases at all.
mhm.
And, excuse me, and I think this will, I hope that this develops into a much better healthcare system.
Yeah.
And that's what is proposed.
Yeah, it made me think when you said, I'd love to hear more if you want to share more, Sonia. But you immediately triggered my mind when you mentioned traditional treating the physical body. I know I brought it up a little bit, but when you said that, it just triggered my mind to the work that is so profound by Elizabeth Kubler-Ross, right? Her book I read recently, I've known about that, The Curve, that the emotional curve, right? It's like a roller coaster sometimes on dying, death and dying. But her book, I just recently, maybe 3 4 months ago, I read her book that was published in 1969. And what was so amazing to me, and I hope for anyone who is interested in not taking the time to read it, please go ahead. It is really a mind shifting, and it did, right? It really impacted the entire medical or healthcare providers' viewpoint on how to treat, because that book highlighted the fact that when, in the case of terminal patients, right, when there's nothing else to do to actually bring the body that was uh, ill, right? It was dying into any intervention or medical pharmaceutical treatments. If there's nothing else to do, the patient was left alone, as if right, I give up, there's nothing to do, let the patient be there in a bed and dying. And what Elizabeth Kubler-Ross highlighted was in the emotional response to dying in this case, there was a need to talk, to discuss, to be embraced, because emotionally speaking, and I would even go on, even though she doesn't call it that, but spiritually speaking, that dying patient needed to talk, to address issues, to revisit, find meaning again, but by revisiting issues that have been somehow buried inside. So I think it's very interesting. I'd love to know more about the study in George Washington, um, and seeing that indeed it's a new way of looking into holistic health. Right?
Right, and I find that those this program
Yeah,
that is currently being carried by the GW Institute of Spirituality and Health gets spread into more
yeah,
healthcare programs
yeah.
because they teach compassion.
Ah,
And that's what, the work of Joanna de Ângelis says. She inspires to look into ourselves, to know ourselves, and learn from our errors, from our mistakes, from our uh, flaws, and
yeah,
to improve.
yeah,
But
yeah,
on the other hand, there's the other person that interacts with us, and in this case, I'm kind of looking more from the medical perspective.
yeah,
The physicians that treat the person who is ill, and sometimes, like you mentioned, it's very important. The dying person. The dying person is suffering from what we call total health, total pain.
yeah,
Total pain is a pain that brings all together everything that impacts health, the social well-being, the isolation, in
yes,
social well-being,
yeah,
the suffering, they are afraid. What is that I'm going to face as I
yes,
die?
yeah,
So the spiritual pain, they need somebody there to kind of bring consolation, to bring some light into what they are looking as the end of everything, right?
yeah,
And not only that patient or that person who is uh, suffering through that dying process, but all the family that is there. They're
yes,
also in need of consolation, in need of assistance, I would say. So that's when emotional, spiritual care comes into play. And that's what Dr. Bohowski talks so much about And I
Mhm.
think it's so interesting. She's not a spiritist, but all
Mhm.
she talks about is compassion, which
I
is the basis of Jesus' teachings, right?
Yeah, yeah. I'm also reminded because when you talk about the healthcare provider and you mention Sonia, the family, right? And it's if I am dying, I am fearing, right? I am afraid of the unknown, especially if I have a very materialistic view. That's my belief system. Therefore, I'm facing the cliff of nothingness. I spent however many years I lived, and now nothing. And what is that enormous fear of this abyss that's coming? And us family members of those who are dying, we need to be aware on how to best approach that person, right? How to best uh, I'm putting air quote here, hold the hand of that person and walk with him or her through that process. But it's not so easy. I'm reminded, Sonia, of a movie. I think it was about 20 plus years ago. And the actress, the main actress, I can see her in my mind's eye, Emma Thompson, who uh, was there. It's called Wit, right? And Wit because she had incredible wit, but the underlying story of it was the fact that she was incredibly intelligent and British, a bit removed, distant, but she taught literature. And so she was renowned for all the work that she did. So her life was very impactful. But then she's diagnosed with an advanced stage cancer of some sort. And the movie explore her her experience with an experimental treatment and how she's left alone, right? And how her wit no longer worked, but it took one nurse to reconnect, to give her a sense of belonging, to really look into how vulnerable she was, and her body was deteriorating, right? And facing death in her case was really emotionally demanding. So this nurse works with her, and it's just beautiful, beautiful done. It's difficult. It's not for everybody to watch, but I think this just brings us the idea of what can we do? I'm not the physician providing the care. I'm not even a nurse, but how can I hold the hand of that person? And you don't have to be dying, but the person who's suffering. And I don't have to be suffering PTSD as our veterans in the US, but maybe I'm just suffering. How can we do that to lead to that integral health that you talked about earlier?
That's beautiful because that reminds me of the definition of compassion.
Okay. Yeah.
Compassion is when we feel at somebody else's place,
Yeah.
but has an additional part.
Yeah.
Is you feel that, but you want to help. You
Yeah.
step in to give a hand. You step in to do something for that person who is suffering.
Yeah.
So you not only is feeling the for that person, but
Yeah.
you step in to help. And to help, as you said, you don't need to be a
Yeah.
physician. If you're a physician or a nurse or somebody in the healthcare,
Mhm.
it's almost your duty to do
Yeah.
that. Not
Yeah.
everybody is educated, has learned how to do that, but it's your duty to do that. But if you are just a friend, a family member, there's so
Mhm.
many ways you
Yeah.
can be present.
Yeah.
And again, I'm referring so much to Dr. Bohosky because
It's so
I
beautiful
was
to
in
hear
a,
that. Yeah, of the
yeah,
work. Yeah, yeah.
I completed a training with her
Oh,
group. So so I learned so much. And they teach about a concept of being present. What being
yes.
present is not there physically. That's not being present. Being present is to come in at that time and make the person feel your connection, feel that
Yeah,
you're connected. So the physician being present is the physician that when the person is facing the end of medical treatment, let's say,
yeah.
there's, there's no more medical treatment available, you
Mhm,
just don't come there and say, I'm sorry, there's nothing else I can do for you.
mhm.
There, I have learned that. I have
Yeah,
heard that many,
yeah,
many
yeah,
times.
yeah,
And that's cruel to the patient to hear something. I have nothing else to do for you. Yes, I do have things to do for you. I can hold your hands. I
yeah,
can
yeah,
be there. I can listen to you. And listening is has such a great power because if you are listening to one who is suffering, you are kind of easing out that suffering.
yeah.
And that's the way we can offer so much help.
Yeah, I imagine that is listening with empathy, right?
Right,
So
right,
I am the caregiver, therefore I'm the stronger. I have the reputation, the credentials to treat you, but now my credentials mean nothing. They're gone. There's no additional physical treatment, but I can be here as a human being and I can treat you with compassion, meaning I recognize your pain,
right.
right, Sonia? I see that you're suffering, and I'm going to alleviate. That's compassion. I'm going to alleviate your pain, and I can
Right.
alleviate with you in addition to treatment, medical treatment. If that's no longer an alternative, I can be there by listening, as you mentioned. I love it. And just for all of us who don't know the definition of compassion, I'm just going to give a little bit of a hint. It's really important, Sonia. It's listening without judgment, right?
Right, right.
It's really listening and responding with the kindness that that person, vulnerable as that person is, needs. Right.
Yeah.
One of the things that I have to remember, and I did this without really, this is a long time ago, by the way, but without any inkling, it just came to me as an inspiration. But I was sought by a friend who could not speak English well, right, and needed a translator of sorts. And I got training as an interpreter before. This is long ago when I worked as a volunteer at a hospital. So I had the training. And so I said, okay, I'll go. And what happened with this person was her husband was diagnosed and with a rare tropical disease, but he was living in the U.S. and no, everybody was really dumbfounded by we can't treat you, we can't treat you, we can't treat you, and she asked me to go with her to yet another doctor and everybody was just brushing. I can't do it, like you said, right? Let me move on to the next or go home and die, if you will. And so I go there, and as I said, inspired. I was quite young. I I looked at this guy as this is unlike any interpreter because an interpreter is not supposed to interfere with the message.
Hmm.
But I said to him, "Can you please look at this man as if he was your father. And please help this woman as if she was your mother to understand the impact of what he's going through." And that's all it took, Sonia. This just this his mannerisms changed completely. He was a young doctor, younger than everybody present, and he just completely changed. And he went to this person, the man who was going through this disease, and the first thing he did is he touched his heart as he was talking to him. And I thought it was quite beautiful. And he
Mhm.
said the impact, he was a cardiologist, so the impact of the disease to his heart. And as he talked in English and I interpreted, that moment was pivotal in the whole family getting back into a better position and eventually treating what was ailing the person. So it's interesting how at the end of the day it's all about humanity, right? It's all
Right.
about how we go down to or maybe go up to becoming humans again.
Right, and I think that's beautiful. That's what compassion means. Is not
Mhm,
only it requires empathy, but it
mhm,
requires more. It requires more than just sharing that
mhm.
feeling. It
Yeah,
requires that you really
yeah,
get into it and try to help the person.
yeah. Um, I think you mentioned earlier something about how uh, ancestral healing, right? How can the genetic code can be changed with a trauma of or something? Can you talk a little bit more about it? I don't know if
Yeah,
you have any thoughts to it, because I think it'd be interesting to talk about depending on what I'm going through, a veteran in this case, or in another case, the man with a suffering, right? A tropical disease in a non-tropical country that nobody could diagnose and impacting the family, or there's so many different ways. How can we be aware of those forms of genetically inherited disease of others?
Marcia, I think there are two aspects that we can
Okay.
talk about that.
Yeah.
Um, they are quite let's say let's begin with the
Mm.
impact
Okay.
of traumas or sufferings
Mhm.
that we go through and that may cause disturbances, changes in our what is called genetic code. We are
Mhm.
born with some genetic with genetic code that basically kind of determines
Yeah.
the way we are, our features, how our health is, our health status, and how we are going to live, whatever. This, at some years and years, some years ago, was looked at the like a definitive uh, pattern
Yeah.
that would govern our some our
Yeah. You're
life.
born with it. You're gonna die with it,
You're
right?
gonna die with it. Yeah, that's it. It was so determined.
Yeah.
With time, we learned that this is not so true. That DNA does not really determine, uh, everything in your life, but things can be changed.
Yeah.
And things can be changed, for example, by chronic trauma, being that emotional or physical. And so, for example, you have a genetic trait to have a perfect uh, liver
Yeah.
health,
Yeah.
nothing wrong there, but or heart, and but a chronic trauma, chronic emotional trauma, or some bad habits like drinking may damage your
Yeah.
organs.
Yeah.
So whatever the genetic code dictated that it would be perfect liver, perfect heart, perfect may be changed by what
Mhm.
we have done. Now there's another aspect. So as we learn that we ourselves can Uh, uh, be aware that by better improving our habits, improving the way we act during
Mhm.
our life, will impact in this what called genetic code.
Mhm.
But there's another aspect: our bad actions.
Yeah.
If we do things that uh, hurt somebody else, that impact on somebody else's life, especially if something really severe,
Mhm.
that will be, we are responsible for every act we do, good or bad, but
Mhm.
especially the bad actions will be imprinted in what we learn in Spiritism as
Yes.
the spiritual body or perispirit, especially guilt, because you do something bad that causes pain to somebody else, and you know that you did something wrong.
Yeah.
You're that's, we have a code inside of ourselves
Mhm.
of uh, how we should behave. When we step out of that, there's like something that is recorded. Hey, that's not right. Even if nobody is judging us, there is a judgment inside of ourselves. You
Yeah.
step out.
My
So,
very childish memory here now is that Lost in Space, where the robot said, "Danger, danger!" this is this
yes,
is triggered in our mind. Hey, something is wrong, but it's up to us to listen to the trigger, right? When we step out of that the code of conduct, the moral code of conduct, or not, right?
right. We have an internal
Yeah,
uh, judgment, I would say,
yeah,
that
yeah,
may be apparent or not.
yeah,
Even sometimes it's not apparent to even ourselves.
yeah,
But, anyways, that is there. When
yeah,
we become aware that we did something wrong, that may create guilt.
yeah,
And guilt really makes an imprint, makes a mark in
yeah,
our in our spiritual body.
yeah.
So that will impact in the genetic code of our next incarnation.
Yeah.
And that's what I was talking about. There are two ways that we can look at how we act and how that impacts on genetic code. It
Yeah.
could impact on our own lives now, present life, or could impact in our future life as a way that the divine laws
Yeah.
are set to impose on our in our improvement, moral improvement, on
Yeah.
our spiritual improvement, in our progress. It's
Yeah.
a way that we can repair the bad actions of past lives.
Hmm.
So this is interesting because, and I go back to some of these scientific
Yeah.
studies. There's one study that was published in 2013. It was called Prioritizing Health Disparities in Medical Education to Improve Care. So that was basically looking at several factors that could improve medical care. But they looked to do that study, they looked into what were the factors that impact on health so that they could improve it.
Hmm.
And they saw that healthcare had a kind of low impact, 10% impact on.
That is so interesting, isn't it?
Yeah.
Yeah.
So they looked at premature death, health status, and
Uh-huh.
the causes of premature death, there was only 10% impact. Environment exposure, 5% impact. What was the major impact? Behavior pattern,
Oh, wow.
more than genetic predisposition, which was 30%. Behavioral pattern was 40%. So that said, this is just a look into patterns that impacted so forth so on. But I think that illustrates how important is moral conduct
Yeah.
again, and that how that impacts on genetic code.
I love it because this is an optimistic view. And I think I think you mentioned in passing that this is impacting public health, right? For example, so if you look at population health for subgroups or entire groups of people, then we start to say, hey, you're prone to this, but think of it, 40%, not, which is the predominant factor, right, Sonia, for
Mhm,
that?
mhm.
Yeah, this is awesome.
So in that paper, in that publication, they don't explain,
Yeah,
where this comes from. Nothing. I'm just using this as an illustration
yeah,
to
hmm,
say that to comment again on what Joanna
yeah,
proposed, that moral conduct
yeah,
plays a bigger role than genetic code,
yeah,
and she is not looking at the present life. She is actually
yeah.
referring to the effect of moral conduct on the genetic code of your next life.
I love it. It's
Right?
not just the past and today; it's the future,
In
everyone.
the future. So I think that gives us a prospect of
Yeah.
what can I do now to live better in the future.
Yes,
Uh,
absolutely, absolutely.
and it's so this is a view that transcends our
Yes.
focus on the present life, and I
Yeah,
think that's important as we understand the spirit as being immortal, right?
yeah,
And that we
yeah,
just have many existences with the objective of improving.
yeah.
So let's try to do something now and improve our next existence, right?
Yeah, yeah.
And I want to mention the Gospel according to Spiritism,
Sure.
chapter 5, Blessed are the Afflicted. And there's a part of the chapter that talks about present and previous tribulations,
Yes.
or the causes of tribulations, the causes of suffering,
Yeah.
and the causes may be in the present life or in the past life.
Mhm.
And if we look, the chapter talks about several things on the present life, especially if we don't really follow
Yeah.
the uh, common sense,
Yeah.
right? And if we make bad choices, all that will be a cause of afflictions in the present life. But if
Absolutely.
we look at afflictions now, something that is afflicting us now, including diseases, illnesses of all kinds,
Mhm.
and we don't find a cause, an explanation in the present life,
Mhm.
we should look into a cause in the past lives, because
Absolutely.
there's no effect without a cause. So it must, if there's a cause, if we don't find here, it's in the past life.
Yeah.
So,
Sonia, we are at the end of our time. I can't
oh
believe
my God.
it. It just went so fast. But why don't you wrap up your thoughts so that we can conclude? But I love our conversation today, Sonia. Absolutely do. But go ahead.
Well, there's so much that I thought that we could talk about, but maybe we have another opportunity in the
There you
future.
go.
But
You are absolutely invited to return. Absolutely.
I think that the message
Mhm.
is to reflect on what Joanna talks in the book that we just mentioned at the
Yeah.
beginning of today's discussion, that we reflect upon ourselves, uh, know thyself,
Yeah.
look at how we are acting, try to be better so that we can not only impact on our health status
Yeah.
during this life, but also in future lives, because we are immortal spirits
Mhm.
and we can live our life of integral health
Yeah.
now, even if we are confronting diseases, if we are confronting death, which is
Yes.
actually a natural process where our cells and our system is becoming senescent. We are losing our um, forces, power.
Yeah.
Uh,
Our vitality, if you will. There is a,
yeah,
and I
yeah.
love if
The
you
vital
maybe,
floor.
yeah, and maybe we can talk about it later, just for that process of aging, perhaps, and
Aging.
losing that sense of vitality and death, right? As something that is very natural, but maybe you can provide us the what's behind it all.
Yeah, yeah. So that's a natural process, and
Yeah,
even confronting all that suffering,
yeah,
we
yeah,
find healing
yes,
if we can actually uh, look into all this as a divine process of reparation, of repairing our
yeah,
bad actions, and that serves to promote moral progress.
yeah,
So we can find ways to balance our emotions, endure suffering with resignation and gratitude,
yeah, yeah.
so that we become healed from inside, even if we are, facing difficult times now.
Yeah. Joanna calls it that dynamic resignation. It's not just I resign to whatever
Right.
happens to me passively, I do nothing. It's very dynamic. But
Exactly.
we are at times, so I would like to take a moment to perhaps say thank you. Thank you to you. And Sonia, thank you to all of you who are here. But to just leave with my own perhaps thought that is suffering is not random, right? It is also not divine punishment, as many of us,
Hmm.
especially from a religious, cultural perspective, some of us keep thinking, "Oh, it's divine punishment." It is not. It's really that sense of continuation, as you put so well, Sonia, of it is a even a sense of refinement on how our moral or emotional response to life, to everything that we go through, and I echo with you, whether it's physical illness, emotional pain, or mental health challenges, maybe all of those are actually part of your spiritual healing plan, right?
Hmm.
Where we are doing this today so that we can heal some ancestral wounds that we're carrying with us, and this, in my opinion, Sonia, completely changes how we approach healing, right? Again, instead of asking why me,
Hmm.
we can start thinking, what can I learn, or how can I transform through this learning? So I think we are here and with the conclusion that maybe physical health, integrated health, is not that perfect body or even disease-free life, but it's the health of your soul, if you will. So with that, I want to say thank you everyone once again, and I need to also thank our sponsors, Mansão do Caminho, the United States Spiritist Federation, the International Spiritist Council, and AMI Brazil, the Brazilian arm of the Medical Spiritist Association. I have to ask you, Sonia, are you still involved with the International Medical Spiritist Association?
Yes, I am. In fact, next week
Uh,
there's going to be the MedNesp, which is the biggest spiritist medical congress in the world. It is sponsored by the Brazilian Spiritist Medical Association, and we are bringing Dr. Christina Puhalski to speak
oh,
at
there we
this
go.
congress.
This is so tight in the how it all comes together, right?
That's
But
right.
we'll be back next week with another episode. I invite all of you to stay tuned, and until then, embrace life, embrace the present, be intentional in all your moments. Thanks, everyone.
Thank you.